And welcome to the Dr. Bob Show. We're going to be spending most of this show talking about the brain. What a wonderful organ the brain is. It's responsible for walking and talking and everything we do. How is your memory? Do you have any problems with memory? Do you forget things and you worry if maybe your brain's not working as good? Do you have trouble making some decisions, maybe financial decisions, maybe balancing your checkbook and you're wondering if something's going wrong inside? Are other people mentioning that you seem confused? Are they worried about your memory? We'll be talking about that on this show. You'll find it very, very interesting. My guest is Dr. Monica Crane. Dr. Crane is board certified in geriatrics, and she's spent her life in geriatrics, treating elderly people involved in neurology with neurology problems. And so we're going to be talking about dementia and where that plays in our life. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about the importance of vitamin D in preventing upper respiratory infections and cardiac asthma. Can you have asthma that's not due to just lung problems, but maybe due to heart problems? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Monica Crane, board certified in geriatrics, spends most of her time talking about geriatrics and neurology and understanding dementia and the problems that go on with the brain as we age. Monica, welcome to the Dr. Bob Show.
Thank you for having me. Really excited to be here.
Absolutely, my pleasure. People worry about their thinking and they worry that their brain is not working properly. What do you tell people?
Well, there are a lot of things that are associated with normal aging. There is such a thing as normal aging. And
good, because I've got that.
And there's cognitive slowing. That's the universal truth. We all slow down with time. So it may be harder to find that word. You might forget and then remember what you forgot. And that's not abnormal. That's part of normal aging. So it's normal to forget names and then recall it even weeks later.
When do you know it's abnormal? Is there a time where you forget names and you can't remember anything? How do you know when your thinking is not just slowing down?
When it starts to impair your function. So sometimes you're able to forget something and compensate just fine, and it really doesn't affect your life. Lots of us are now outsourcing our memory to our phones, so we have the numbers typed in, so we don't remember anyone's number. That's normal. However, let's say you don't remember your phone and you don't remember how to use your phone. That's a little different.
And you don't remember where your phone is or how to work it?
Well, a lot of us misplace our phones, but maybe we're able to retrace our steps.
So if somebody finds out, who usually makes the decision that something's going wrong? A loved one that's watching that, or the person that says, you know, I'm just not thinking right. I can't remember people's names and I should be remembering them?
A lot of times it's a spouse or an adult child, a family member who says, you know, mom, dad, or my wife is just not thinking quite right. There's a change from normal. So the other thing that you have to have a diagnosis with is a change from your normal self. So a change from your baseline.
You know, and I see that all the time in people at church, where you see some friends and their spouses will say, I'm worried about my spouse.
Yes.
That they're not thinking well, they're not remembering as well, they perhaps are not making decisions as well. Is that something we should worry about?
Absolutely. I think it's always important to listen to family because many times they have the diagnosis. They're able to say, these are the symptoms.
So when somebody comes in like that to your office, what do you do? Do you have testing that you can do for these people?
Well, firstly, one of the critical things is to say that dementia is not part of normal aging. And I wanted to define that for you, if that's all right.
That's perfect, because I imagine there's one walks in toward the other.
Absolutely. So the term dementia is actually not a diagnosis. It is an umbrella term to describe a group of symptoms. And those symptoms must impair your thinking, and it must impair it enough that it affects your day-to-day activities, and it must be progressive. So it's a progressive degenerative brain disorder that progresses into a dementia syndrome. But you can't have a diagnosis of a dementia.
So if somebody has dementia,
Yes.
has a grouping of symptoms, could it be due to one of several causes?
It could be due to one of 100 causes.
Wow, so there's a lot of things that can cause
Absolutely.
dementia. So the things that we encompass under dementia would be, for instance, what?
For instance, one of the most common subtypes is Alzheimer's disease. And so sometimes you'll hear the question, is it Alzheimer's or dementia? Well, dementia is the umbrella term. Alzheimer's falls under the umbrella. It's the most common subtype, about 60 to 80% of all primary dementias. But then there are all of the others. So it's important to get a good history because each dementia is a little different.
Do you find it easy to differentiate from the different dementias? We'll talk about the different dementias later on. Is it pretty easy to separate them or hard?
I think it can be challenging, but I think a lot of it is just the power of observation. In our office, we'll talk to families, get a good history, do cognitive testing. So look at paper and pencil testing, computer testing to figure out where there's a problem in thinking, because that maps out to different places in the brain.
So you can do that with testing. You can
With paper testing,
with
absolutely.
paper testing,
Or
so you
computer
can tell if
tests.
it's on the side of the brain or the top of the brain or the back of the brain or the front of the brain.
Sure. There are some patterns that we look for.
So if it's frontal or frontotemporal, what patterns fit into there?
So with a frontal disorder, that's the big powerhouse that makes us so smart, right? So the problem in frontal temporal dementia is you see problems in decision making, or we call executive functions, so complex tasks. So we can do different tasks that really test that concentration and attention.
Pretty accurate?
And I think you could see patterns. Again, it's patterns. It's just a clue. You have to put the whole package together. It's a combination of seeing a patient, talking to the family, getting a good history, doing a neurologic exam, neuropsychiatric testing or cognitive tests, and sometimes additional imaging or what we call biomarkers.
Are there other illnesses that can interfere with your testing? If somebody has thyroid disease, or if somebody has other problems, heart failure, high blood pressure, on medications, do those interfere with your cognitive testing?
Sometimes other illnesses, especially if you're acutely ill, it's really hard to test someone when they're quite sick. But most of our patients have other diseases, a multitude of diseases. And a lot of the comorbidities or other diseases that affect your body actually affect the brain. So many times we start with that baseline and we can look for a change in that individual over time.
When you see a patient and they've got early symptoms of the dementia umbrella, do you think in your mind there's a lot we can do for this patient? Or it's going to be a progressive thing and there's not a lot we can do for them?
I think there's always a lot we can do for patients.
And that's great. What is the plan when you think there's things that we can't do?
Well, firstly, we need to come to a diagnosis. So once we arrive at that diagnosis, sometimes it takes several visits, additional brain imaging, and once we get there, we can talk about the treatment plan for that specific dementia type. A lot of times just knowing what you have is the first step, because if you don't know what you have, you don't know how you can plan ahead or how it progresses.
When you find the diagnosis of early dementia, you have to bring in the rest of the family. You have to start thinking about long-term care and how to take care of the person that's involved.
Yes, absolutely. I think there's planning. It's very different in each different type of dementia in terms of what we advise families.
So what do you do? What do you advise them?
Well, do you want to start with Alzheimer's disease?
Yeah.
Okay. In Alzheimer's disease, depending on where you're at, we talk about what drugs are available, where your loved one is at on the timeline. So are you early? Are you moderate? Are you a little further along than you thought? And then what drugs are available. So there are FDA-approved medicines at this time. And then there are clinical trial opportunities, but a lot of the interventions can be non-drug interventions. So we think that some of those tools are really powerful, things like diet and exercise.
So there's lots of things that we can do to help people.
Yes, a lot.
And that's what we're going to be talking about when we come back. What can we do for somebody that's got dementia? Are there certain pills that will help? Are there certain exercises that will help? Are there certain stimulating brain exercises that we can do that will help? A lot of information I'm excited to learn. We're talking with Dr. Monica Crane, and we've been talking about dementia, a grouping of symptoms that are umbrella over a diagnosis of certain things like Alzheimer's disease. But there's a natural aging that we have of the brain that's not dementia. So you can have some normal things going on with thinking and not have the umbrella dementia under a diagnosis. Is that right, Monica?
That is right. And so it's a continuum, a cognitive continuum. Think of it as a spectrum. And what we're trying to do is diagnose people earlier and earlier. We think it's very hopeful. Think of a cancer. If you diagnose it before it spreads all over the body, much better outcome. Same thing with the dementias, particularly Alzheimer's disease.
So we need to be thinking, we need to know something about Alzheimer's disease. We need to know about what symptoms to look for to find it early. What do we look for in mom and dad or brothers and sisters as far as seeing early dementia symptoms of Alzheimer's?
Well, I'm looking even earlier, thinking about what comes before a dementia syndrome is something called mild cognitive impairment. And mild cognitive impairment is when someone is experiencing some thinking problems, but it doesn't yet impair daily function.
How do they know if they're not thinking well? You know, if we don't get enough sleep, we don't think well. If we've got stress, sometimes we think better, sometimes we don't think as well. There are things that make people not think as well. How do you know when that's entering into cognitive impairment?
The difference is a change from baseline, so a change from your normal self, which perhaps is getting a little worse. And usually it's a spouse that says, hey, something is not quite right, but a spouse is functioning fairly well. And it's a time when we think you can really get good treatments, and we think that that's going to be a very hopeful stage.
So how about word searching? You know, some people say, oh, I can't remember that person's name. And then you remember it later on. You said that's a normal type finding.
Yes, that's just remembering later.
So if you can't ever remember that person, a cousin or an uncle or an event, is that a sign that you may be having cognitive impairment?
It may be if you were particularly good at names. There are some people that have always been poor at names, and so it's not a change. So it's always important to look at your own history. Is it a change from the baseline? But we think in this mild impairment range is when plaque, so it's one of the pathologies, one of the proteins that starts to clump up in the brain in Alzheimer's, we think that's when it's starting to build up.
So if somebody's seeing some early symptoms in somebody else, in a spouse, in a friend, somebody in a social environment, should they encourage that person to seek help? And what kind of help do they seek?
Well, I think the first thing is, once someone is amenable to getting an evaluation, seeing someone like myself, I would see them and do the cognitive testing, do those paper and pencil and computer tests, and maybe even additional brain imaging.
So brain imaging means x-rays?
Well, there are a couple of different types. An MRI of the brain looks at anatomy, so looking at specific structures that shrivel or atrophy. Another type of scan would be a PET scan of the brain, looking at sugar or glucose uptake. So we think that there are changes in the way the brain uses sugar, and we look for patterns on those scans.
So you can look for shrinking, or you can look different kinds of activity that will point you toward cognitive impairment?
Absolutely. We think certain patterns, especially if you're having minimal symptoms, but you have an Alzheimer's pattern on the imaging, it's like detecting something before it's manifested itself.
And if you can detect that early, then you feel like there may be more that you can do for that person.
Absolutely. We think that that's a critical time where you can implement lifestyle changes, and a lot of the drug companies are looking at medicines to really be very aggressive at that stage. So that is very hopeful. I think it will be a curative disease.
Wow, now when you say curative, that's very, very exciting. We look now on Alzheimer's as a progressive neurodegenerative illness. Those are big, long words. It just means it keeps on going until the brain doesn't really function at all. So if you find it early, what are some of the things we do?
So what can you do to fight it early?
Yeah.
Huge study looking at diet. So nobody likes this, but this might be one of the magic pills. So the Mediterranean diet, so eating on a daily basis, lots of fruits and vegetables, very little red meat, lots of fish, omega-3s, that appears to be very protective. They've done a meta-analysis, which means lots of studies put together worldwide, and the Mediterranean diet seems to be most protective to the brain.
You know, the Mediterranean diet is protective to the brain, to the heart, to the blood vessels. It's one of those things that I always tell people, Google the Mediterranean diet and start changing what you eat according to what that tells you, because there's so much information on that.
Yes.
And that can help people brain-wise. What else? Diet, the food we eat.
And aerobic exercise. And what I mean by that are programs like walking, doing any kind of class, doing the machines, perhaps an elliptical machine and a stationary bicycle, swimming, a continuous exercise on a daily basis or at least a few times a week.
So we talk with people all the time in the Dr. Bob Show about being sure you eat properly, like the Mediterranean diet, and that we exercise. There's so much that regular exercise does for people. So we feel that exercising helps the brain, or helps the progression, or helps slow down the progression. What does it do?
So exercise actually does more than just increase circulation and that sort of thing. They did a huge study in the Midwest looking at couch potatoes that are now in an exercise program. So they randomized, they put people in an exercise or just told them to continue their behavior. And those that exercised had decreased shrinkage in the part of the brain that's important for the memory. So the decreased shrinkage of the hippocampus, the memory area.
So there's a lot to what we're saying about eating right and exercising. How about sleep? How about social activities? How about brain games? Do those do anything?
Well, I'm really interested in sleep as well. I think that that is newer evidence. There's an association, a relationship between sleep apnea and the brain. There's also a relationship between not sleeping well and the brain. We think that it accelerates Alzheimer's, especially if you have an underlying sleep disorder that's not being treated. So we encourage people to use their CPAP machine.
So there's a lot that's going on when we find something early to eventually make this where we hope it's going to be a curative disease. What do medications do for Alzheimer's?
Well, there are a couple of drugs that target different brain chemicals. So it's important to remember, what does the drug do versus what is it labeled for? So there's a medicine called donepezil, there's another medicine called memantine. These are different drugs that are pills, or there's even a patch version as well. And they modify or alter different brain chemicals. So some of these chemicals are depleted in Alzheimer's disease.
So if it's depleted, is it depleted where the nerve endings meet each other and it keeps that activity better, the medicine?
The medicine allows the activity to stay a little longer.
So, and what does the memantine do?
The memantine modifies a brain chemical called glutamate, which is a stimulant for the brain. So sometimes too much of a stimulant is a bad thing. So it kind of calms the system down. And there's the thought that it has a neuroprotective effect.
So you're dealing with people with cognitive problems, with dementia all the times, with Alzheimer's. You're dealing with these people all the time. Therefore, I'm seeing you say there's great hope. The earlier we find it, the better. We find it with suspicion, with testing, with imaging, and then we exercise, we eat right, we sleep right. We always say in the Dr. Bob Show, you got to have a lot of laughter in your life.
Yes, I think so too. But I think the idea is an early diagnosis is an excellent thing. It is not going to necessarily change your life in the sense that you can function, you're still able to do. So the whole goal is to get an early diagnosis so you can continue to do as well as you've always done. And also, lastly, the drug treatments that are in the future, the very near future, hopefully will stop the disease.
Is there an easy test to find out early onset of Alzheimer's? Can you go to the internet? Is there a testing that's available to people? Or do you have to go to a sophisticated physician who deals with this all the time in order to get an accurate diagnosis? Is there a easy way to try and find out for people?
I think that a lot of times just knowing if you have symptoms. So family members are probably the best at diagnosis, better than any test. However, at your Medicare wellness exam, they do now do screening. So a primary care doctor could do the screening. I think not everyone needs to go to a specialty clinic, but there are a couple of ways to screen. So the whole idea is just screen. So whether it's going on the internet, finding other programs, one of my colleagues, Dr. Doherty, developed a computer test. So there are a lot of different options to get screened. Just do it.
Do it and find the diagnosis early and then start getting adequate treatment. Monica, you're a great teacher. Would you come back and teach us a little bit more about the medications that are available, what they do, about other types of dementia, how we find those out, what's going on in the brain, and what our hope is in the future?
Yes, I would love to, Dr. Overholt.
It's exciting for me to watch your excitement, to know that there's things that we can do for people with this problem that worries us all. It really does. So I'm so delighted to have you on the show, to meet you, and to look into the future of dementia.
Yes, wonderful.
Isn't that a great show? Know that early detection is what you want. So if you're worried about it, think about it, do something about it. Get tested. It's not going to hurt you to get tested. If you don't have it, wonderful. If you don't have early signs, wonderful. If you do have, great, because then there's something that we can do about it. So don't push that aside in the direction of your health. And now you're going to want to stay tuned. We're going to be talking about vitamin D, a lot of new information on vitamin D and how it can help your immune system, help you, and cardiac asthma. Yeah, there's a real diagnosis where the heart can cause wheezing. You'll want to stay tuned. I want to thank Dr. Monica Crane. Wonderful discussion on dementia. The biggest thing is, if you even think you're having dementia, get it tested. Early acknowledgement will make treatment and cure a possibility. So be sure and get that done. Now, questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob, does vitamin D really help the body? Well, the answer to that is unequivocally yes. Let's talk about vitamin D. Vitamin D has three basic purposes that help us. Number one, it helps the absorption of calcium so the calcium can go on the bones so we can get good, strong bones. So know that vitamin D is very important in that. Number two, recent studies have shown that vitamin D at an adequate level will stimulate your immune system to fight off upper respiratory infections. So it keeps people from getting recurrent upper respiratory infections. And number three, it decreases or helps autoimmune illnesses that people have, like lupus or autoimmune thyroid disease. So yes, vitamin D. You need to get your vitamin D level tested. We get vitamin D from two sources. Number one, from sunlight, but we worry about sunlight causing skin cancers. So we put on sunscreens to keep out UVB. That's what converts the material in the skin into vitamin D. So get your vitamin D tested. If it's low, then you can take vitamin D supplements, and those supplements will allow the calcium to be absorbed, will allow you to have less upper respiratory infections. So know that vitamin D is very, very important. Question number two, Dr. Bob, what is cardiac asthma? Well, asthma is a condition where the airways go into spasm or the airways are narrowed. And when we breathe in and breathe out, we hear wheezing noises. We have obstruction to the airflow that's there. Can the heart actually do that, or is it something else that's causing asthma? We know that asthma can be triggered by allergies, frequent cause. Sometimes people just have what we call intrinsic asthma, where the airways simply intermittently go into spasm. But when people have heart problems and go into heart failure and low-grade heart failure, then there's fluid that gets in the lungs and fluid that gets in the airway, and so people are having wheezing and cough and shortness of breath that's not really due to asthma, but it's due to the heart. So if you're having cough, wheeze, and shortness of breath, always think of the possibility, is my heart functioning well? Have I got edema of the lower extremities? Do I get chest discomfort, chest pain, heart rhythm problems? If you have those, think about maybe it's your heart that's the cause of your wheezing. Get that corrected. Well, that's all the time that we have for this show. Remember, it's exercise that we think is the best thing that we can do for health. It decreases stress, it lowers blood pressure, it helps us lose weight. And now we know that it can even help delay the onset of active dementia. Be sure that we're eating properly. Google the Mediterranean diet. Look at the Mediterranean diet. More fruits, more omega-3s, more fish, more nuts, more vegetables. Get 7.5 hours sleep. Know that 7.5 hours sleep is going to make you feel better, you're going to perform better, and you'll be happier. And speaking of happier, it's that laughter in your life that's really going to make you healthy. Laugh a lot and you'll stay healthy.